To answer your first question, when will doctors and nurses and staff be put out of business? I don't think the answer is anytime soon. I would not worry about artificial intelligence replacing doctors or nurses or anyone else. Artificial intelligence is there to provide an aid. It's an assistant. It's like a virtual nurse for you. And if you depend too much on it, it's actually to your detriment. Okay? I look at artificial intelligence in 4 phases. So what is AI in terms of transforming the healthcare industry? The first important thing I see is data management, because AI can store lots of information, lots of data on everything, including the patients, including the doctors, including the staff, including the hospitals themselves. So you can actually see over a period of time how your hospital are moving forward and progressing, how are the doctors moving forward and progressing, and how is patient care being taken care of. The next and more controversial one is, does AI have a role to play in diagnostic and finding solution for people who are sick? Okay. And that's a question that each hospital or doctor needs to ask themselves that question. Because if a young doctor relies too much on what the black box is telling him, the black box is an AI, so I put in the systems, he has a cold, he has or she has arthritis, and what is the solution to that? So do I depend on the doctor, or do I depend on the black box? And that's a critical question that's going to be asked by everyone. And if you're a young doctor, you might want to depend on the black box, because you can always blame the black box, right? It's not my fault. The AI told me to do it this way, right? And if you're an experienced doctor, you might not trust the data and say, I have more experience than you do, box, therefore I'm doing it my way. So diagnostic to me is the critical question mark on where AI stands. AI is very important in terms of logistics. Okay? If someone is, where are the hospital beds that are free? Where are the individual skill sets that are available? So if I have a heart attack, do I go to hospital A or hospital B, depending on what's available in that hospital? So you have to have that information available as well. And I think where AI can play a very critical role is actually in training and building capacity. Because you don't want young doctors to operate on live patients with no skill sets. AI, virtual reality, augmented reality will enable doctors to spend the time to train, to operate in a virtual reality where you're not affecting anyone. And when AI, we're talking about deep learning now, when AI introduces deep learning, where you have thousands of data points, even millions of data points, integrated into an application or a tool. So now I can practice not only on operating on a man or a female, but I can practice on operating on a man who's 60 years old, who has high blood pressure, who has diabetes, versus a man who's 60 years old and in good health. It's 2 different bodies. Right now we can't do that. But if AI is able to start learning the different aspects of it, it can guide you in these right directions as well. So those are the 4 elements I see what AI can do for us. So one thing that I really like is wearables. You know, we all have our phones. We all know that how many steps we take per day. But if you look at the actual new wearables available now, all the data points on your body could be monitored. Right? And you could actually alert someone before you have a heart attack that you're having a heart attack, because it's monitoring your body for you. And then in terms of the healthcare industry itself, predictive analytics and insights is also important. Your smartphone becomes almost a health tool for you. You have the information, you can take selfies and actually turn into a diagnosis. In fact, we have hackathons every year in February in the UAE, and one of the winners was a young team of 2 young men who looked at using selfies to diagnose certain illnesses. And that could be something as simple as jaundice, look at the facial aspect of it, and identify what particular aspects could be even for it. So wearables become a very major important point to play as well, because you can actually monitor every piece of your body through wearables. Not now, but in the future you'll be able to do that. And that allows doctors to have a historical aspect of you without actually seeing you. So if your monitoring system is monitoring your day-to-day activities, when you get sick, the doctor has a history of what you've done the last month, the last 6 months, the last year, and they can actually determine where your stress level is at, what actually caused the problem, and so forth. So to me, wearables is one of the big issues that the future will be looking at as well. So the four major issues in terms of illnesses and globally are heart disease, lung disease, diabetes, and obesity. And those four can actually be monitored through a change in lifestyle. Right? Again, this is wearables come into play. Because if you exercise more often, if you eat the right food, you're in better position to live through these issues. So if you have high blood pressure, if you have a cholesterol in terms of your obesity, if you're a diabetic, if you have lung disease, changing your habits, changing your lifestyles will enable you to live a longer life. And the wearables can actually guide you in that aspect as well. So today I did my 10,000 steps. That's the little goal that everyone sets for it. And to me, I try to do it every single day. So when I'm at 9,000 steps and I'm 1,000 short, and even it's 11 o'clock in the night, I still go outside and try to get my 1,000 steps in it just to reach that goal. But imagine if all the work that you've done in terms of your dieting, in terms of your exercise, can be put in a database somewhere, where artificial intelligence can review that aspect of it, and then can basically guide you in the right direction. Okay, now you've done 10,000 steps for the last 6 months. Let's go to 12,000 steps. So you're actually building yourself up. You're building your stamina up, and you're creating a better lifestyle for yourself as well. So those are things that I think are very important, is that your lifestyle will help predict how long you're going to live. If you're smoking every day, if you're drinking every day, if you're not exercising, eating a lot of fatty foods, the odds are you're not going to live very long. However, you can still try to reduce that stress level on your body by exercising more and using the wearables to go forward. So imagine if you had this type of dashboard for your body. So everything you want. You could have oxygen levels. You could have how fast your heart beats. If you look at the hospital, how many patients the hospital runs a day? You know, how good or how bad are the doctors? If I have a high mortality rate in hospital A, I would go to hospital B instead. But I don't know that information. You know, how good are the nurses? How good are the facilities? And this dashboard can be created based on pure data. The more data elements you have, the easier it is to predict something. Okay? My hospital mortality rate is at 0.1%. Why? Because the doctor looks at his phone all day long while not listening to you or not talking to you. He's just writing things down on his little iPad. No eye contact, no visual contact. How much trust you going to have in someone like that? There's no compassion. So people think that AI is just pure data and there's no compassion whatsoever. And it is, because it doesn't tell you whether it's a young person or an old person. So if you use the decision-making process to the black box, the AI, to make a decision, and you have two options. You have an old person who's 75 years old and a young child that's 5 years old. And you only have one option to save both of them. And the AI black box says the older person is sicker, you should treat him or her first and let the young one die. Because that's what it is. It's looking at the pure data aspect of it. I don't care about the compassion aspect. I don't care about anything else. It's from a data point of view, save the older person because that person is dying first. But as a doctor, right, you have a choice of how to make that decision. And that's where the compassion comes in. This is why I say I don't think AI will ever replace doctors. Because doctors have a very big role to play in determining the solutions that's going to keep people alive and determining what's the best solution or procedures to help people out there. The AI tools are essentially helping doctors make the right decisions. And I don't think they should make the decisions for the doctors. Okay? And I think that's a big area we need to make sure that it's clear as well. Okay? So here are the challenges. So when AI and doctors disagree, who do you listen to? The doctor or the AI? Who says doctor? Who says AI? See? All the young guys say AI. We don't trust you old people here, right? Because, right? If you're young, you believe in data, right? And you want to make sure that I have the best data available in order for me to find the right solution. But if you're an older person like me, you want experience. You want to make sure the person has done this operation many, many times, Okay? Now, if you select the AI, what happens if something goes wrong? Who do you blame? You can't blame the box. You could kick the box, but the box is still going to be there. So who do you blame? Ministry of Healthcare. There you go. Right? So, and that's going to be a very big legal question in the future. Okay? So when something does go wrong, and it's solely based on AI diagnostics, who do you blame? Do you blame the person who created the algorithm to make that decision? Do you blame the doctor for not listening, for listening to the AI? Who do you blame? And that question will come into play fairly soon when you put too much dependence on something else as opposed to your own skill sets. Okay? And how do you ensure the patient's privacy through AI? Okay? Because the AI will share information with other AI systems. Right? That's the gathering of data. I'm gathering data all over the place. Therefore, I know that if you're 80 years old and you're going to die tomorrow, and I have a 20-year-old who can live for another 60 years, the odds are I'm going to treat the 20-year-old. Well, AI might say treat the 80-year-old. Okay? So the legal aspects of AI become very important, and that's where your policy and law should be looking at, is what are the legal aspects of using artificial intelligence, blockchain technology, augmented reality. What is the legal aspect to it? Another challenge is that AI also has prejudice. It's not a racist box, right? But it's based on data. So the more data you have on men versus women, it'll be more effective treating men than women. The more data you have in terms of children versus adults, it will be more effective in treating children than adults. So you have to be aware of that. Right? You have to be aware of what treatment is going to be provided for you. Right? If I'm a poor person and I cannot afford a full-time nurse, and the AI tells me you need a full-time nurse, it doesn't help me. Or I have to go to a hospice or something else, it doesn't help me. So you need to build into that. So what deep learning does is the more data that it gathers and analyzes, the better information it can provide you, who will be the ultimate decision maker. Because at the end of the day, you will decide, not the box. Okay? So I mentioned it before, limited data is going to be critical. So if you look at AI now, you're just starting to gather information. And by the way, AI is much more than a chat box. Okay? AI is really deep learning, going into information and studying it from beginning to end. So you want to make sure that there's enough data available for each segment of the population, whether you're a newborn, a child, an adult, adolescent, and so forth. And once you have that information available, then AI becomes the big important aspect. Otherwise, there are lots of possibility of having inaccurate diagnostics because simply the data is not available. Okay? So what I want to leave you here today with just two things. Number one, AI is not going to replace your job anytime soon. Okay? Number two, try to grapple around the legal aspects of AI, because that's going to be a critical issue in the near future when you're depending on AI. So, when we look at the AI strategy, we have three options. The business and product innovation. You want to have continuous innovation, continuous creativities, right? And that's why the importance of 5G technology, the fast-moving information, data's flying left and right. You want to have the right AI technology in place to develop the right strategy. In terms of platform, okay, you want to make sure that the AI in your organization is referenced and has a reference architecture. You can reuse the services. The infrastructure is there. You're using deep neuron networks to store information. Right? You're creating an environment that's trustworthy. Right? If you don't trust the data, right, you're not gonna use it. So you have to trust the data. It has to be high performance and scalable as well. And the last thing is the culture and workforce. You want to make sure that your hospitals, your doctors, your nurses, the entire staff uses AI as a support mechanism, but not as the ultimate decision maker. You can create a very high performance culture by working together, as opposed to letting one dictate over the other. Okay? So keep track of the legal aspects of AI. and do not worry about your jobs. So that was the first question you asked me. And I'll say it again, do not worry about your jobs. Because I'm going to get sick eventually. I'm going to need you guys here. And I'm not going to trust the box, all right? So thank you very much for your time.